And joining me now, Montel Williams, former host of the Montel Williams Show, actor and Marine veteran. Thank you so much, Montel, for coming on. Let's talk about this issue because I know it's very personal to you. MS, you've been battling that condition since 1999. You have a foundation to help people who have multiple sclerosis. When you heard this bill pass, what was your initial reaction?
Well, I have to tell you, that report that someone did was probably one of the smartest reports that you guys have done or anybody has done on this issue to date, because what people at home don't understand, when you say terms and things like pre-existing conditions, they really are basing this on what an insurance company has stated was a pre-existing condition. So they think about 22% of Americans have a problem. Right this minute, this is from the National Institute of Health. Over 56% of adult Americans, over 120 million adult Americans have one chronic illness, and about 80% of them have at least two. So these numbers that people throw out are so wrong. Listen.
And we're putting up a list of some of these pre-existing conditions, and the bottom line is insurance companies get to decide what constitutes a pre-existing condition,
Correct.
which I understand is one of the reasons people like yourself are so concerned about what this bill does, even though people who have pre-existing conditions may have access to health insurance.
Some.
The question is, can they afford it if this Obamacare mandate were repealed?
I'm very lucky. I mean, I and a lot of maybe that 2% of Americans can afford whatever health care we need to have. But the rest of Americans can't. And when you're talking about people who, like, I hear from people who suffer from MS all over the country today who can't even get medication. And MS is one of those conditions.
Why can't they get medication?
Because they're not insured. Our medication costs over $1,500 a month. This bill, which is so ridiculous, only addresses things like pre-existing conditions, but we don't talk about how are we going to lower cost. You could say you might want to insure somebody, and then you say the insurance companies, well, I'm going to charge you for that insurance. How can the normal American expect to pay over $20,000 a year just for a shot or a medication to keep them alive? That's only one. A lot of conditions like the ones I have can be up to $100,000 a year to $200,000 a year.
Well, that is what
That's what insurance
the fear
is for.
Is, right? And